I'm Dr. Jennifer Gaudiani. Thanks for joining me for another reading from my book, Sick Enough. So we've gotten to the end of the boxes, and those were the little stories that I wrote at the end of each chapter that shares a metaphor or story that I share to help my patients. So in order not to stop this, for me, very enjoyable reading aloud to you, I decided that I would finish by reading bits of my conclusion one at a time and finishing off the whole conclusion to finish up this reading aloud series. So I hope you enjoy it. This is going to be starting conclusion, how we can each make a positive contribution. And on my book, this starts on page 243. I've been asked countless times, either at work or at dinner parties when people find out about my profession, do you have any thoughts about what I can do to protect my kids from eating disorders? The person asking might be the parent of a toddler, hoping to prevent future problems. They might want to help their teenager manage the pressures of social media. Or they might be someone with an eating disorder who wants to avoid creating another link in a generational chain of body image problems, or who would like to share these ideas with their families to create positive changes in the home. I will wrap up the book by offering my thoughts on this important topic. The reality of eating disorders is that they are complex, multifaceted disorders, and prevention can't be reduced to a simple formula. While there's no guarantee that doing or not doing any one thing can prevent an eating disorder, these suggestions feel like a good place to start, as they, at the very least, teach people how to stop contributing to social body image pollution in an already smoggy world. Section 1, don't talk about your body. My first recommendation is to stop talking about your body. No comments, either positive or negative. This is because a focus on body appearance, especially when a narrow set of ideals are applied to concepts like beauty, acceptance, or health, is unscientific, nurtures internalized size stigma, and may induce shame or body dissatisfaction. Your children, especially if you have emotionally attuned, sensitive children, are watching you like little hawks, learning to follow your cues. Don't celebrate if you've lost weight, and don't complain about any aspect of your shape or size. Don't criticize your body when out clothes shopping, and don't decline to get in the pool because you're ashamed of how you look. Your child loves you, and almost certainly loves your body because it belongs to you. If that knowledge isn't enough, or if you find yourself in a dynamic where your child is reassuring you that your body is just fine, it may be time for therapy. No child should have the burden of reassuring their parent that they are acceptable. Being exposed to a parent's self-criticism clouds a child's beautiful, innocent wisdom by the growing awareness that if their beloved parent dislikes their own body, then the child's body might be unacceptable as well. Women in particular tend, for many of the reasons discussed in this book, and many that are beyond its scope, to openly criticize their bodies. This has become an acceptable social topic. How much weight you gained over vacation, what diet you'll try next, how healthy you feel after a cleanse. To a certain extent, women are taught by society not to act too full of themselves, not to come across as overly confident. So upon receiving a compliment, women may immediately come back with a self-deprecating reply like, oh, well, these jeans are just flattering, you should see me in a bathing suit. Stop. How can we say we're trying to raise confident, body-positive children when their idols are tearing themselves down? Answer a compliment with a smile and a simple thanks. Teach by example. I'll see you next time to continue reading more. Take care of yourself.